Appreciate all of you coming this morning. I'm Jesse Laslovich. I have the privilege of serving as Montana's United States Attorney. This is an important day for our office and our federal partners, and I'm proud to announce that today, due to extraordinary multi-agency investigative work, we have entered into a settlement agreement with St. Peter's Health here in Helena regarding violations of the Federal False Claims Act that we contend were committed by St. Peter's Health. Prior to getting into the specifics, I want to acknowledge a few people. First, Assistant United States Attorney Shannon Clark, who led our office's efforts in this matter, which spanned multiple years. There were many claims that needed to be analyzed, as well as text messages and emails and correspondence, and her thorough approach was critical to getting us here today. AUSA Clark would tell you she didn't do it alone. And indeed, we had another AUSA, Ryan Weldon, who assisted in getting us across the finish line, as well as a contracted analyst in our office, others, and importantly, a special agent for OIG for the Health and Human Services Department of the federal government. In addition to the United States Department of Justice and St. Peter's Health, we are joined in the agreement by the Office of Inspector General of the Department of Health and Human Services, the Defense Health Agency, acting on behalf of TRICARE, the Office of Personnel Management, which administers the Federal Employees Health Benefits Program, the United States Department of Veterans Affairs, and the Office of Inspector General of the Railroad Retirement Board. All of these entities are federal programs. I'm grateful to each of them for their assistance and support throughout this process. This matter was initiated by St. Peter's Health when they voluntarily self-disclosed misconduct, and I want to acknowledge their efforts throughout the process, which among other things included sharing the results of an internal investigation they conducted, disclosing relevant documents beyond existing business practices or legal requirements, and making relevant employees and officers available for interviews during the course of our investigation. I thank them for their professionalism and cooperation throughout the process. After conducting our extensive investigation, I can now share the following. First, we contend St. Peter's Health submitted or caused to be submitted false claims for payment to Medicare, Medicaid, TRICARE, the Federal Employees Health Benefits Program, and the Railroad Retirement Medicare Program for healthcare services performed and referred by Dr. Thomas Weiner, an oncologist employed by St. Peter's Health at its cancer treatment center during the time period covered under this settlement. Specifically, we contend that from January 1st, 2015 through December 31st, 2020, St. Peter's Health, relying on Dr. Weiner's documentation and certifications, submitted false claims to federal programs for services performed by Dr. Weiner for outpatient or office visits, as well as inpatient or hospital visits. We contend St. Peter's Health relied on Dr. Weiner's documentation and certification when it knew or should have known that Dr. Weiner's assigned CPT codes, or current procedural terminology, were either coded at a higher level of service than was performed, or upcoded, or did not meet the requirements of a significant separately identifiable service, or were non-payable claims. So upcoded claims and non-payable claims. These submitted upcoded or non-payable claims were false, and we allege in violation of the Federal False Claims Act, which simply prohibits the submission of false claims to federal programs. One of the purposes of the False Claims Act is to protect the American taxpayer from paying for false claims submitted by healthcare providers to federal healthcare programs. With this settlement, we are honoring that purpose.